what do you think about conventional medicine or allopathic medicine and its approach to treat blinding disorders like RP or macular degeneration or Stargardt?
With my background, I was trained in traditional Chinese medicine, West medicine, and public health, epidemiology. So I understand West medicine completely. My parents are also Western medicine physicians. I grew up in the medical family. Also, in my university medical school, I have spent a lot of time to study the history of Chinese medicine, history of West medicine, the philosophical roots, and comparative analysis, all that. So to answer your question, from my background, my practice of West medicine and Chinese medicine and public health, I can say when we approach vision problems, and we come from two different philosophical backgrounds. West medicine start from Newtonian physics and the paradigm, and tend to look at human body as a structure, a mechanic, a machine structure. So when we're treating eye problems, our focus is on the eye. So we either do a surgery to remove the pathology on the eye, or we give medicine as eye drops on top of the eye, or we make artificial retinas. We make the glasses, we implant the sensories, or we try to inject stem cells or genes into the eye, try to change it. Let's reflect the philosophy of Newtonian science, the structure. While Chinese medicine comes from a holistic view of health, and when we look at the eyes, the problems, we think it's a disorder of the whole body. We will look at the heart, the liver, the kidney, the lung, to see where the weakness. Normally, the relationship between those organs has a disorder. What our approach is, we use needles, herbs, try to balance those organs. We don't touch the eyes. Let's say we use acupuncture, but we don't needle the eye. We needle on the face, her back, but we don't needle the eye. So after we adjust the organ, the structure in the eyes improve by itself. Spontaneous healing. It's a body's own healing capacity we utilize. So this come another philosophical difference is in West medicine, we tend to think the human body as a machines. It's just like a car, a clock. If some part is wrong, we need a physician come to replace that part. If a knee is wrong, we do knee replacement. If a retina degenerated, we want to transplant a healthy retina, or we need to transplant artificial retina to improve it. But in Chinese medicine, we regard human body as a self-organized, healing, living system. When some part of body is wrong, we know the body will start their own healing, repairing process on their own. They have their own wisdom. They are not passively waiting for the doctor's repair. The repair already happened the moment there's some disease. What our role as a physician is to assist this self-healing process with food, exercise, herbs, acupuncture, massage, all that. So in the traditional Chinese medicine philosophy, the doctors is only nature's assistant in healing. That's why when patients come to me, some patients respond super fast, some people respond slow. And it's not all depend on the treatment. It depends on how healthy the body is. Let's say we have a patient from India. She is a mathematics teacher. She came in with less than 10 degrees of visual field. And in 3 days treatment, she gained 180 degrees back.
Wow, that's amazing.
Yeah, so you can't deny this result. It's true. This is the best response we ever achieved. And we also have patients, they come, we take 2 years treatment. He just stable, he never improved. He remained at less than 30 degrees, he never improved. So because over the past 23 years, I have seen more than 1,000 cases. I see this difference. My training in public health and epidemiology training helped me to analyze what's the determinants of the outcome difference. You know, why some people respond better, some people respond slow. One difference is how healthy the body is. Let's say that mathematics teacher, she's healthy, happily married, and she do yoga every morning herself. She's a healthy diet. You know, her body basically fit. That's why when she get help, like assistance, her body just heal itself spontaneously. And the patient who didn't respond, you know, after 2-year treatment, the patient are happy. Patient said, "Oh, Dr. Yu, if my vision does not getting worse, I'm very happy." But I'm not. I said, all my patients are getting better. Why you didn't improve? So I go deep. He is a software engineer, and he look at computer all day long, and heavily work, heavy reading, heavy stress. So he don't have a regular gym or exercise program for himself. That's why I can see a difference. It's not the treatment of the doctor makes the difference alone. Because it's body's own healing process, how strong the body, how fast, how well the healing will happen. Then I suggest the patient, software engineer, I said, give up job, stop working. And so after he gave up, you know, he asked from his company 6 months, you know, and he do part-time job. He will not read, as I read computer less than 4 hours a day, every day. And then he come here for treatment. We normally take 2 weeks treatment, and he came for 4 weeks. We extend his treatment time. He reduced the workload. Then I start to see the progress. His visual field start expanding, vision start to improving. So if I take the same philosophy, I think it's a mechanic structure. And if something wrong with the eyes, I have to replace it, repair the eye directly on the eye. We will not get this kind of result. So that's mechanic view of human body and holistic view of human body. That's the difference. In the past, you think in Europe, in India, the Ayurvedic medicine, they all take this view. And there's no this, all Asian medicines like that. Just in Europe, because of the West medicine becomes so dominant, most of those practices disappeared. But in India, in China, those traditional medicine is still there. And I happen to use this approach focused on RP for 23 years. I was able to observe, to see the difference, to figure out regularities, what works, what does not work. So what really we got here, it's a treasure for medicine and for those patients. Yeah.